Hello, my name is Ian Appleyard. I'm the Research and Policy Manager at the British Acupuncture Council. Now, acupuncture has become a lot more popular in the past 20 or 30 years or so, and now there are millions of treatments given every year. Most of these treatments are not provided within the NHS. So when people are looking for an acupuncturist, often they want to understand how do they find a safe and competent acupuncturist? And another question they may have is, how safe is acupuncture in and of itself? So in this presentation, I'm going to cover those issues. The presentation has 4 parts. The first part will look at the landscape of acupuncture. By landscape, I mean what are the regulations and licensing requirements that apply to acupuncturists working in the United Kingdom today. The second section will look at the safety profile. So how safe is acupuncture? Third section is to look at the British Acupuncture Council itself, and I will describe what we do to ensure that our members are safe, adhere to professional codes, and meet very high educational standards. The fourth section is on the Professional Standards Authority. Professional Standards Authority provides independent assurance that the British Acupuncture Council is a genuine regulatory body for acupuncturists. Most healthcare professionals in the United Kingdom, such as doctors, nurses or physios, are all statutory regulated. This means that they've done the correct training to become a doctor or a nurse, and also they belong to a regulatory body, such as the General Medical Council. However, what is the situation for acupuncturists? Acupuncture is not statutory regulated in the United Kingdom. This means that anybody can set up as an acupuncturist, irregardless of how little training they've had. In addition, it's possible for people to set up companies or even just websites that purport to be acupuncture associations or federations, which can make it very difficult for people when they're trying to understand how well trained an acupuncturist is. However, everyone practicing acupuncture in the United Kingdom should have a license with their local authority. There are a number of slightly different laws that apply to this, but essentially they're the same thing, that you have to have a license with the local authority. In addition, all of these laws apply to tattooists and body piercing. So acupuncture is put in with that group rather than being as a healthcare profession. The focus of local authority licensing is on the room itself. So that means that somebody will come around and check and make sure that the room is clean and has all the facilities necessary to deliver acupuncture cleanly and hygienically, which is of course important. However, it is limited because there is no assessment that the practitioner has knowledge of acupuncture or Western medicine, and there's no means by which a patient, if they feel that the practitioner behaves inappropriately, can raise any concern or complaint. In addition, because local authorities are implementing these laws slightly differently, there is variation across the country. So we've looked at the licensing and regulations as they apply to the United Kingdom. So now we want to ask a question of how safe is acupuncture and what does the research tell us about acupuncture safety? Over 20 years ago now, the British Acupuncture Council took part in a study to find out how safe acupuncture is when delivered by traditional acupuncturists in the United Kingdom. Now this is a patient report. So basically patients were asked to fill in a questionnaire as to whether they thought they had suffered any adverse events from having acupuncture. So over 6,000 patients took part, and collectively they had over 30,000 consultations, so more than 30,000 acupuncture treatments. The study was published in 2004 by Hugh Macpherson et al. The Macpherson et al. Study shows us that approximately 10% of people who have a course of acupuncture report having at least one adverse event. The most common adverse events are tiredness, pain, and headaches in this particular study. Now, adverse events does sound quite dramatic and negative. However, we do need to dig in a little bit so we can understand it more fully. With any therapy, patients make a decision. Do the benefits outweigh the side effects or the adverse events? As we know, with medication, sometimes people feel drowsy or they get stomach problems. And that on occasions means that the person feels that it's not worthwhile taking the medication because the benefits they're getting from it are not sufficient for them to put up with the side effects. So in the Macpherson study, of course, they would look at this, and they found that of the people who had an adverse event or reported an adverse event, the 10.7% of people, 94% of those people were still willing to have acupuncture. So the vast majority of people who suffered some adverse event still wanted to continue having acupuncture. So overall, there's a very, very, very small percentage of people who have an adverse event and it actually leads to them not wanting to continue acupuncture. And this is represented in the pie chart, so you can draw that out. So basically, it's just the adverse event we're going to stop. That's the red piece of the pie chart. And in reality, that's 40 people out of over 6,000 who had a course of acupuncture. The conclusion of the Macpherson et al. Study is that acupuncture is relatively safe when practiced by regulated practitioners. Now, the word relatively just informs us that acupuncture is safe or relatively safe when compared to other treatments that are available for people with this range of conditions. Now, the other word we have to think about is regulated. So British Acupuncture Council members who delivered the acupuncture in this study are well trained. They've done at least 3-year training in acupuncture. What the study doesn't tell us, however, is how safe and what the risks are for people who've got less training. There is something else I'd really like to highlight about the Macpherson study. It's the notion of severe adverse events. So they identified 3, and it's so useful to dig in and have a look at what those adverse events were. And it does show something about the nature of research and what gets classed as an adverse event. So patient 1 had breast cancer and lower back pain. After the acupuncture, she had a night of hell, in her words, but the next day, the back pain completely disappeared, and 6 months later, she had no back pain and was still having regular acupuncture. And probably most people would consider that as a treatment success, but actually it's been put in as a severe adverse event. So that's an interesting thought on the research process. Similarly, the patient, in case 2, if you like, had ME, and after the acupuncture they had chickenpox-like rash all over their body, felt ill for several weeks, and felt a deep emotional pain. However, 3 months later, they described their treatment as a miracle, which again, many people would say that was a treatment success. So the third and final severe adverse event reported in this study was a person who had a car crash. Now, this car crash occurred 2 days after the acupuncture, and at the time, initially, they felt it was due to drowsiness from the acupuncture. Subsequently, they agreed that it may well have been that they had stayed up late the night before, and that was the cause of the drowsiness. So, let's have a little think about the 3 severe events. Basically, for 2 people, they had dramatic responses to acupuncture, but overall, they felt that the acupuncture was beneficial. When we think about the adverse events, all of them together, well, we can see there's no lasting harm, and the vast majority of the adverse events are temporary. And then we remember that just 40 out of 6,000 plus people didn't want to continue having acupuncture, and that's perfectly reasonable. Sometimes people feel acupuncture is just not for them. The benefit they get compared to maybe a pain or needling or feeling drowsiness, they decide it's just not worth it. But overall, no severe, long-lasting harm. Now, it is often the case with research that size matters. The more people you treat, the better understanding you get of whether a treatment is beneficial, and the better understanding you get of what are the risks and harms. So therefore, I want to talk about a study that was carried out in Germany. This is Witt et al. 2009. Now, this was carried out on over 200,000 patients each person having approximately 10 sessions, and that means we're looking at the results from 2.2 million acupuncture sessions. So one of the nice things about the Witt et al. Study is that they do break everything down, and they've got quite an interesting table where you can see all of the adverse events and roughly how many people got out of that 2.2 million treatments. The number of patients that experienced at least one adverse event is 8.6, which is slightly lower than the Macpherson study. I don't think it's a meaningful difference, as it were. It's just quite often the way the data is collected, you can get this kind of fluctuation, potentially at any rate. But it's the same ballpark. Most of the adverse events were minor bruising or pain, again tiredness, but less common than the Macpherson study. And importantly, I think, the adverse events were generally of short duration. The Witt et al. Study also reports on severe adverse events. So in the study, we can see that there were 2 pneumothoraxes. Now, a pneumothorax in acupuncture is when the needle is inserted too deeply and it damages part of the lung. By and large, we would say this is likely to be caused by practitioner error, and that brings us to a thought of training and qualifications of practitioners. Fortunately, in the study, both of the people recovered. One person just required observation and the other person hospital treatment. Overall, there were no deaths or permanent injuries from the 2 million plus people who took part. The longest lasting injury was one to the nerve, and that lasted for 6 months. The conclusion of the Witt et al. Study is very similar to that by Hugh Macpherson et al., that acupuncture is a relatively safe form of treatment, relative compared to other forms of treatment. The only real difference is in the Witt et al. Study, the acupuncture was provided by doctors, German physicians who had some training in acupuncture. So as I previously mentioned, one thing about research is the more people that you have in your studies, generally the better. So one way we can increase the numbers is by adding studies together, and these are called systematic reviews. So there is a systematic review looking at acupuncture's safety, and this was published in 2021 by Bäumler et al. So now the numbers get very large indeed. We're looking at 22 articles reporting on 21 studies, and overall covering 12.9 million treatments. The Bäumler et al. Study can be considered one of the stronger pieces of evidence because it is actually the combination of a number of different trials put together, and the numbers are much larger, over 12 million treatments. They conclude that acupuncture can be considered one of the safer treatments in medicine, noting that severe adverse events are rare. Common adverse events are mild, so these are things like bruising and feeling a bit tired. So they do note that there's possibly a need for us to think about how we classify an adverse event for acupuncture, as if you feel a bit tired, maybe that is actually a good thing. So when talking about adverse events, it's quite helpful if we just think through the difference between a side effect and an error. So there is a bit of a scale, it's not absolute, but on one side for acupuncture we've got things like tiredness, bruising, etc. These are clear side effects in many ways, that they are inevitable part of acupuncture. It's very difficult to predict sometimes whether someone's going to feel tired afterwards, and we may actually think it's a good thing, so not even a side effect in that case. But they can be minimised by good care and attention. Similarly with fainting and nerve damage. And once we get to the error end of the scale, pneumothorax, we know by and large it's going to be through needling too deeply, not warning your patient not to move, etc. And infections. So all of those things, pneumothorax infection, we should be looking to completely eliminate. But in order to do that, training matters. And even to minimise the negative side of the side effects, if you like, is through training. So fainting can be avoided if we make sure the person's not too hot, they're not hungry, stressed. Again, underlying that is the training that can help us reduce all of these potential negative consequences when having acupuncture. There are a couple of other safety concerns. The first one is delayed diagnosis. So if you go and see an acupuncturist and they're treating you, when actually you really need to go and see your GP and have your condition properly checked out using modern technology and tests, etc. The second concern is that seeing an acupuncturist, the practitioner may encourage you to reduce your medication when that is not appropriate. So you can see that both of these concerns are particular about seeing an acupuncturist who is a traditional practitioner working in private practice, rather than seeing a GP who practices acupuncture within the NHS. Both of these concerns have been looked at within the research. The study I spoke about earlier, the McPherson et al. Study, asked patients these two specific questions. Basically, they found there was no evidence that seeing a traditional BAcC acupuncturist meant that patients were at any greater risk of delayed diagnosis or being encouraged to reduce medication inappropriately. However, this does not tell us the risks that apply if you go and see a practitioner who is not as well trained and doesn't belong to a regulatory body such as the British Acupuncture Council. So rather than discouraging people to see their GP, what the McPherson et al. Study actually found was 11% of patients were advised to go and consult their GP or hospital specialist. It is part of the British Acupuncture Council's core training requirements that a practitioner is able to identify red flags and knows when to refer when appropriate. So in this next section, we're going to look at how the British Acupuncture Council ensures safety. What are the systems that we have in place to make sure that our members are well trained and professional? The British Acupuncture Council Guide to Safe Practice ensures that our members have a comprehensive understanding of how to deliver acupuncture safely. Our members must adhere to the Code of Safe Practice. Both of these documents have been developed and updated over the last 30 years. They have drawn on the external expert advice and also the knowledge base of British Acupuncture Council members. The British Acupuncture Council employs a Safe Practice Manager who is able to give additional advice and support to the membership. We also run an adverse incident reporting scheme and liaise with stakeholders such as environmental health officers. The Safe Practice Manager serves as a central point of contact so we can learn from any areas of concern and further develop our guide to safe practice. A significant concern for many people when looking for an acupuncturist or any healthcare professional for themselves or for a relative is to ensure that the practitioner acts in a professional and appropriate manner. So in this section, we will look at how the British Acupuncture Council promotes high standards of professional conduct. British Acupuncture Council members must adhere to our Code of Professional Conduct. Like the Code of Safe Practice, this document has been developed and improved over 30 years. The Code of Safe Practice and the Code of Professional Conduct are freely available on our website for anyone to download and view. So if you're seeking healthcare from a statutory regulated healthcare professional, such as a doctor, a nurse or a physio, there is always a means in which you can raise a concern. If you're not happy with the treatment, whether you think the person is acting in an unprofessional manner. Because acupuncture is not statutory regulated, you are not guaranteed to have a way in which you can raise a concern. So I've represented this as a picture. So if you see a British Acupuncture Council member, the people in blue, then you do have a means of raising a concern. However, you might see a practitioner who either doesn't belong to an acupuncture organisation or belongs to an organisation that has no proper and effective means for you to raise a concern. So if something goes wrong, if you have an issue that you would like to raise, there's really not much you can do about it short of taking someone to court. Many of these people may be making innocent mistakes or simply be not as well trained as a BAcC member. However, within the profession, we have to consider the possibility that there are some people that are actually acting in a quite malevolent and unprofessional manner, and I've represented that by the red person. Of course, if that happens, then really the only thing that you can do is take someone to civil court. On the British Acupuncture Council website, you will find our policies and procedures to enable you to raise any concerns that you may have. And you can raise a concern about a member or the British Acupuncture Council itself. The British Acupuncture Council employs a professional conduct officer who is legally trained. They are there to help ensure that both patient and practitioner get a fair hearing whenever there is a concern raised. It also enables us to learn from situations and further develop our advice to members to help ensure that there are fewer and fewer issues that come up in the future. The absolute core of both of these issues, professional conduct and safe practice, is education. So now we're going to look at how the British Acupuncture Council ensures that our members are highly trained and well educated. So here is a diagram that explains how we ensure educational standards are maintained. If we start on the left-hand side, the BAcC membership and lay members come together to help develop the British Acupuncture Council's educational standards, which, like the Code of Safe Practice, like the Guide to Safe Practice, is a living document that's been developed over 30 years. They are supported in that by our partner organisation, the British Acupuncture Accreditation Board. Now, the British Acupuncture Accreditation Board and the BAcC work together to develop what is called the Accreditation Handbook. Then, separate to the BAcC's work, the British Acupuncture Accreditation Board makes sure that the colleges that are accredited meet our educational standards. British Acupuncture Accreditation Board includes acupuncturists, students, and also lay members. So fundamentally, we get down to the college, it provides the 3-year degree level training, and at the end of it, we have a fully qualified BAcC member. Like many other healthcare professionals, British Acupuncture Council members must do CPD. This ensures that their knowledge and skills remain up to date. We support them to do this through webinars, through our website, through an e-news, an Acu magazine, European Journal of Oriental Medicine, and our annual conference. Now, this is probably the most important section of the entire presentation. All of these things, the Code of Safe Practice, the professional conduct, our educational assurance system, all of this is all well and good, but how do you actually know that it's happening? How do you actually know that we are developing our professional codes? How do you actually know that the British Acupuncture Accreditation Board is going into the accredited colleges to make sure that they are training students to the sufficient standard? Basically, we need a third-party independent assessment that the British Acupuncture Council is doing what it says it does in terms of regulation and maintaining standards. And the way that we can do this is through the Professional Standards Authority. So the Professional Standards Authority is an independent organisation set up and accountable to the UK Parliament. Its objective is to protect the public through working with organisations that register and regulate people working in health and social care. It has 2 branches to the work that it does. One is to work with the statutory regulators, such as the GMC, the NMC, and Healthcare Professions Council. So it makes sure that those organisations are regulating the doctors, the nurses, the physios properly. It has a second branch, which is the accredited registers, and the British Acupuncture Council is one of those. So the Professional Standards Authority accredited register status is a means by which we can verify and show to the public that we are doing all of the things that we say that we are doing. So the educational standards, the opportunity for you to raise concern if necessary, and all of the development of professional codes and the fact that our members must adhere to those professional codes are ensured. So to reiterate, the Professional Standards Authority was set up by the government to protect people when seeking healthcare. Now, if you're seeking healthcare from a non-statutory regulated professional, then you should look for somebody who is on an accredited register. By finding someone on an accredited register, you can have confidence when choosing their services. It is perhaps not surprising that the General Medical Council's guidance on delegation and referral states that doctors, when referring patients to unregulated professionals, They must be confident that systems are in place to verify the safety and quality of care they can provide. And one means in which they can do this is to look for somebody who is on a Professional Standards Authority accredited register. The same is also true for NHS employers. So you go to the NHS employers website, we talk about using services from non-statutory regulated professions. It will emphasise that you should find somebody who's on an accredited register so that you can have peace of mind that the person is trustworthy and committed to achieving high standards. You may have noticed if you go to the NHS website and look up acupuncture that the recommendation is that you find an acupuncturist on a Professional Standards Authority accredited register. The British Acupuncture Council provides a network right across the United Kingdom, which means that anybody who is seeking acupuncture, either for themselves, for a relative, or a friend, can do so and find a practitioner who is highly trained, professional and safe. Therefore, if you would like to find an acupuncturist, I recommend that you visit our website and use the Find an Acupuncturist function. If you would like to know more about the safety profile of acupuncture from the research, then all of the articles that I've cited in this presentation are open access, which means that you can search them online and download them freely and look through them yourselves. Thank you for listening to this presentation. If you would like to know more about acupuncture, find an acupuncturist, please visit our website. That's acupuncture.org.uk.